So we always talk about going too fast on viral healthcare or watching the downsides of being too early on jumping on a new innovation, a new idea. Today, we're going to kind of contrast that with an organization that has done agility or moving fast once you go down the pathway in a very efficient, effective way. Hi, I'm Bruce Spurlock. I'm a physician and healthcare leader committed to helping decision makers navigate change with clarity. On viral healthcare, we explore the trends spreading across America, and we just look at them for how to sustainably and effectively implement them. So today, I'm glad to welcome to our podcast Maulik Joshi. Maulik is a good friend and been around for a long time and really understands this world well, and I'm so excited about you getting to meet him. Maulik is the president and chief executive officer of Meritus Health. Meritus Health includes the Meritus School of Osteopathic Medicine, Meritus Medical Center, and Brookline Health. And the mission of Meritus Health, and I think you're going to see this as we talk a little bit more, is to improve the health of the region by providing the best healthcare, health services, and medical education. Before he was the president of Meritus Health, he was the executive vice president of integrated care delivery and chief operating officer at Anne Arundel Health. And I worked with him most closely when he was with the American Hospital Association with a Health Resource and Education Trust, where we did a lot of work with hospital quality all across the United States. And he's published in many journals, he's published books, he's on many boards, he's on the editor of journals. I mean, he's just been around and has seen everything in American healthcare. And it's my pleasure to welcome Maulik Joshi to the stage today. Maulik, you want to introduce yourself a little bit?
Hey, Bruce, first of all, thank you so much. As everybody should know, I have nothing but total admiration for you. It's been a pleasure to work with you and do consider you a good friend. So I just thank you for everything you've done. Thank you for being on. I think you've hit a lot of what I have a little bit of a public health background. So that's probably a little bit different than a lot of hospital CEOs and health system CEOs. And, we've created things. So that's a little bit different. I haven't walked into a lot of existing places that have all this, but we've built things like we did together at the Health Research and Educational Trust. So I don't know. There's nothing else other than to say I've been very fortunate to work with good people who are very caring about mission and health, and that's what's helped me in my career. So thanks for letting me be on.
Yeah, I didn't mention that Meritus is in Western Maryland, and that whole region is the area that you're trying to improve health for. It's not just the people in the cities where you're located, but the whole regional approach, which I really think is really impressive. All right, let's talk about things that go against this grain of a shiny object. So we think about trying to warn and worry about organizations jumping on fads too quickly. But the issue isn't always jumping on too quickly. It's when you jump, even if it's at the right timing, is not executing effectively. And that's what agility is all about. Can you describe that for the audience? Talk about what does agility mean to you, and how do you try to drive your organizations to be rapid, effective on implementation, on decision making?
Yeah, and I have to go back to COVID, a silver lining of COVID. So COVID hits. I started my job 100 days before COVID started at Meritus in Western Maryland. And so you come in and it's like, okay, let's figure this out. And that's when I'd say within a month in, we realized we love this culture. People talked about it as a crisis management, but it's much more than that. So COVID hits. What do? We said, we're going to stop everything. We're no longer going to have senior team meetings. We're not going to do this stuff. Every morning at 8 a.m., we are going to huddle in this conference room, like 50 of us. And we are going to have a project manager up front, and they're going to keep track of everything we do that day. And they're going to come back at the end of the day and report out on everything they did. And that sort of routine, that cadence, we kind of like working this way. This is kind of fun. I mean, hey, we need to set up a drive-through testing. Say, all right, but what do we do? Well, you got 8 hours. Come back at 5 o'clock and tell us what you're going to do. And people would go at it and design ideas and redesign, piloting things. And then we'd come back and we said, sounds good. Let's start it tomorrow. And that's how we went. So I think COVID got us to think about it means continuous quality improvement. I think people think about agility and they think, oh, quickly do something. But it's really not just that. It is doing something, improving, improving. And so that's one. It's swift planning. Agility is we didn't spend a couple of weeks to put together a 20 slide deck. We said, all right, here's some idea. We did some quick research. Let's figure this out. Let's go for it. It means constant implementation, right? So it is, you said execution. It is rapid execution. If it didn't work today, let's figure out for tomorrow. And then if not, let's change it. So to us, it's not cutting corners. It's planning quickly, it's executing quickly, it's improving quickly, and it's using metrics to see how you're doing. That's what I would call as implementation. It's hard. Maybe we're biased, but it's at quality improvement.
So one of the things that you described, especially right here at the end, is this idea of, not every test is going to work, not every execution, not every implementation. So you're going to have failure. And I think then one of the things about agility is you fail a lot, right? But we talk about failing fast and failing forward. Can you describe what that means for your organization and give us an example of how a failure doesn't necessarily mean you're going to have a setback? It's going to teach you to go in a different direction.
Absolutely. If this fail fast, I think, is something, yes, we all get, but intuitively, we don't like to fail. But yes, you have to. So I'll take the drive through testing as one example during COVID. We said, all right, let's just set up in the back of a medical office building, drive through testing. If you can drive up, we're going to swab your nose and we're going to give you a result in 24 hours on my chart, our electronic patient portal. And we said, let's just try it. Let's put it out in the newspaper back then, and let's just put it out there and see what we get. Day one, we had 1,000 cars, and we had a line 4 hours long. Like, okay, we're it's going to be hard. All right,
Yeah.
tomorrow, what are we going to do? All right, okay, we can redesign the flow. We can have more people there. We can have more registering pre-up. We figured out day two, it was probably cut in half. Day three, cut down to an hour. I mean, we made the so that's failing fast. And as long as you tell people the why, right? Look, we're here to protect our entire community. It is a long wait, but we're trying to take care of everybody. As long as you stay focused on the mission and look at measures along the way, I think people can do that. But in 3 days, we went from whoa to hey, we got this down. That's pretty darn good, right?
That's outstanding. Outstanding. What's the role of the leader in that kind of thing? I mean, do you get out there and look at the lines, or where do you do and how do you manage it as the leader of the organization?
Absolutely. First of all, you're surrounded by a great team. And so, but yes, we are out there, right? So I didn't out there doing my PPE and anything, but I mean, improvements are designed. So we're out there timing. What is the car length? How's it going? We're out there trying to figure out how can we communicate the hours differently? Can we do them more staffing up front, more later, less in the middle, all that sort of stuff. Yeah, it's leading by the front line, right? It's someone told me about getting close, right? I believe in that completely. You can hear stories, you can do that, but you want to get close. You want to hear it from somebody.
Yeah, yeah. And seeing it in your own eyes is the only way to really feel it, right? You can't emotionally take it in unless you actually see that in action. All right, for people thinking about, I want to make my organization more agile. What do you think's holding them back? What are the key challenges for an organization that might be more bureaucratic, might have a lot of committees, might have a process by which they have to have checks and balances, 15 ways in the process? How do they change?
So one, I think, is tradition, right? We've just always, I think lots of organizations have their senior leadership teams get together 2 or 3 hours a week, sit around a table, discuss things. Just stop it. Don't do it anymore. Just say, we went to huddling because of all this. So we actually wrote a little paper called Just Huddle. Stand outside our office 8 a.m. to 8:15 a.m., 4 days a week, have a theme every week, have some specific topics and follow up, and make decisions that way. That's how we did. And our leadership team for years has not sat down to meet. That's how we meet. That's how we make decisions through S bars. You want to make a major decision, write up an S bar, send it out to the team, meet with the appropriate people, come back to the next huddle or the appropriate time, give the feedback and say this is a decision, and we move forward. So
Tell
one,
everyone what an S bar is. For those people who may not know what an S bar is, that's a great tool.
situation background assessment recommendation, right? So it's a very standardized team steps type communication tool. And what it says is, hey, I'm the VP of HR. I have a suggestion of changing our employee contribution to health insurance premiums next year by this percentage and by this different way between family and single. Here's my situation. Here's the background on what's going on. Here's my assessment of what we can do. Here's my recommendation. 1 to 2 pages, send it out to everybody in the leadership team. The 3 or 4 people who may have the most employees or the most interests get together as a group one on one. You come back and you say, all right, here was the recommendation based on the feedback. Let's go. Tools like that make a big difference. I think it's disciplined, it's structured, and that you think doesn't sound like agility, but it facilitates agility.
So interesting. So one of the challenges when I've talked to executives across the country, they're worried about not including the right voices. So, when you make a decision, they've had bad experiences where they didn't include in this person or that person. So then they get these big decision making teams that are 20 and 30, or they have, processes. They go to this committee and that committee. And the reason they said that they do that is because they've had big disasters when they haven't included the frontline voice, or when they haven't included this department or that department. I was a practicing physician in an organization where I got an email, literally got an email, and there were 14 committees that had to approve one field change in the medical record. 14 committees had to approve one field change. And so when I asked them about that, it's this fear that they have about leaving out voices, about, they need this consensus. How do you overcome that?
Yeah, it's a great point. Trust is one, right? So first of all, you should communicate with everyone, your S bar or whatever the topic. So that's one. It's up to the leader to go back to their respective teams and get that feedback. I think that's critical. It's not someone else's responsibility, it's us as leaders' responsibility. I think you ask for what, forgiveness instead of permission sometimes, but you've got to be inclusive. It doesn't mean you need 18 committees. You can be inclusive in different ways. And I'm using small examples, but if you want, I could jump into a bigger agility like starting a medical school or building a unit and talk about how that works.
Yeah, talk about a complex project, because I know that kind of scares people a lot. These big, complex, hairy, months long, years long kinds of things. Talk about the medical school. That's a great one.
Yeah, so I would say it took 3.78 years from when I just said to somebody in the hallway, "What do you think about a medical school?" to having the first students on campus. So, how do you pull that off? I think number one, again, I said it, we just started conversation about it, we laughed about it. Within 60 days, we had a board call to say, "Here's a slide deck around this concept. What do you think?" Now, we could have taken 6 months for that, right? But the reality is, in 60 days, I probably talked to a dozen deans. We went to visit a place. We all, you do kind of that SWOT approach. You get in and you learn, you get close. I'll tell you, I pulled down the standards of starting a medical school, an osteopathic medical school, and read all 80 pages. And I said, yeah, we can hit these things. So I didn't rely on someone else. I didn't rely on AI. I think we had AI then. Maybe we didn't. But I said, you got to learn this. We did that. 30 days later, we had a next call. 30 days later, we had a next call. 75 days later, we hired a dean. That's how fast you can move. So it takes a great team. It takes trust, but it really, again, constantly, that slide deck changed every single day. And we kept talking to people all the time. But that's how you keep building momentum.
I'd got some folks on the inside of the Institute for Healthcare Improvement, the IHI, when they were talking about bringing out the 100,000 Lives campaign. And there were people that told me that if there was too much discussion about it, we'd have lost momentum and it would have never happened. And so that's one of the things is if you've got something like this and you're building momentum, if you keep it up, it goes. If you sort of lose track of it, you got another priority that comes along the way, another good idea, another shiny object that happens. So this discipline of sort of like taking and building on momentum is really critical and really a hallmark of an agile organization.
I think so. And the one thing I would say is some people think you're cutting corners because you're going too fast. I don't buy that. I think you can be disciplined and fast. Some people think those are two different approaches. I don't. I think if you've got the right structure, the right process, the right trust, and great leadership systems and processes, you can make it go fast.
Okay, so let's drill on that part a little bit, because I think one of the things that people fear by going fast is they're gonna make mistakes. We talked a little bit about failure, but this is different than like implementation failure. We're testing new idea, then go test another idea. This is like some catastrophe is going to happen. We're going to miss something because we're going so rapidly. How do you put safeguards in place? And I know metrics, you've mentioned that 3 or 4 times. Talk about metrics and some of these other safeguards that help you protect from some of the downsides.
So we're a dashboard happy organization. So I have roughly 150 dashboards of anywhere from a unit all the way to the entity. So you got to look at this. And every leader is expected to do this. We have a playbook. It's not me looking at all of them, it's our team. So I think you have to have metrics, right? And you constantly look at those. So that should tell you what's going right or wrong. The second part is I think it is in your culture and DNA, right? I mean, you have to get to that, I guess, in one sense, to be able to execute, but you got to build that startup mentality. I was fortunate to be part of a startup at one point in my life. I believe healthcare should operate more like a startup. I mean, operate like it's my dollar that I'm investing. I'm stewards of our money, and that's how we should treat things. If it was our own physician practice, we always joke, like, would we change the chairs every 3 years just because it's time? No, we'd go until we think, well, maybe it's time. In larger systems, like, oh, it's cycle, let's just change up. But these chairs are fine. What are we doing? So I think you have to kind of break that and just say, we're going to act like a startup and have that entrepreneurial mentality. Metrics is a big part of it. And then constant communication, right? You got to communicate all the time to see what's missing.
So talk a little about, the people side of it. I'm really interested in the people side of it too. So someone in your organization isn't agile, right? That's not their nature. They were born more deliberative, contemplative. They're not bad people. That's just
Right.
how they look at the world. They look at, like, I want to sort of understand, completely feel comfortable. My intuition says I should really research it more. How do you know when you're getting into sort of data analysis paralysis, or when you're in dealing with people in the organization that are, just they don't move that way, they don't act that way? What's the people piece of that?
Yeah. So the easy part is recruitment of new people, right? So when we recruit, our interviews are pretty. I just had one today, and questions are always about agility. How comfortable are you with unknown? How good are you with this? And what happens? Tell me when you failed one time. What'd you learn from it? How do you work forward? So that's the recruiting end. On the retention side, I think we have to find different ways to approach it. Some who are more analytic and research want to. There's great leverage to use those skills in these processes. Somebody's still got to do that up front to be able to move forward. So it's a great question. It's just constant nurturing. It's all about culture, right? At the end of the leaders have to say, this is the culture we want. We keep coming back to it again and again, and that drives us.
So have you ever had something that didn't go the way you wanted? Or maybe you're still an agile organization and you pulled the plug. I mean, I think that's okay too, right? If you go down a pathway of a project and it's not going exactly the way, and you say, maybe we should stop. What's that like? What's that like for you when you think about, yeah, maybe this isn't right for the organization?
Yeah, so we tried one thing called our Promise team. We thought, wouldn't it be great if we had 6 to 8 people who just circulated throughout the hospital and ED and just focused on patient experience? They didn't have to be clinical, but they were there talking to patients, trying to figure out what was going on. This should impact patient experience greatly, right? I mean, just people who were trying to help you out. It didn't. We tried it different ways. We said, well, maybe the ED is a terrible place because, at that stage, they just don't want another person involved. All right,
Right.
all right, maybe it's the inpatient. Okay, well, maybe it's not labor and delivery. They're so happy. You're really not going to impact that. Okay, we won't try that. Maybe it's med search. Well, they're here for 3 days. If you catch them on day 2, it's not as good. We tried everything for about 12 months. Didn't work. And so we kind of stopped the program. So it is difficult. We found new roles for everybody, but these things happen. Now, I'm happy to say it didn't take 4 years to figure it out. It was
Yeah.
12 months, but we were changing every month how we tried to approach that. So these things happen, but you learn.
No, no, I think that, I mean, that's the thing. The one kind of danger I see, and I try to counsel people, is like formally end it, right? Just announce that we're moving on and say this is something we learned about, because people are afraid of failure again. We go back to this fear of failure, and when they have to stop something that obviously isn't working, they kind of let it die off. And I like, just learn, tell the organization, this is what we learned. We tried this for a year. We did these kind of things, and now we're going a different direction. And I wonder what you think about how transparent, how obvious, how much you should just sort of hold yourself accountable for those kinds of organizational failures.
You should. I mean, that's how you gain trust from people, right? By doing that. Another example that we're grappling with right now is AI, by the way.
Oh
So
yeah.
we have a call center. We're actually looking at, do we bring in AI agents to replace a number of individuals in the call center? And at this stage, we're saying no. We don't want to just reduce FTs. We want to give people other opportunities, and we're not built yet to do that. So until we get that HR function going, we're going to hold off a little bit. Now, maybe that's the wrong move, but I think those are the type of things you have to decide. That's the shiny object. It's easy to sign up AI agents right now for call center. I could find 12 companies that'll do that with us for free, it seems like, for now. But I think you have to think through some of these things as well.
Yeah, that's another thing we talk a lot about on viral healthcare is not jumping on the shiny object when you have it. And again, there's a whole bunch of momentum building things that go out. First of all, people come and produce, come in, your vendors, like you just mentioned, come and hit you up, and they're all over the place. And then you have colleagues who are doing it all the time. How do you sort of step back to make a decision? What is it that you did on this example that said we're going to hold off just a little bit longer?
I think for us, it came down to people. We really wanted to, healthcare is still people based. We are here for our community. One of our values is community obsessed. So you keep those values front and center. And when we thought through this, like, maybe it'll save us a little money, but is that worth what we might have as other costs? So you have to weigh the benefits and costs. So medical school, do we really want to spend $275 million? Academic hall, student housing, all the faculty, all the loss until you get to break even? And the answer was the benefit of generational change in our region outweighed that cost. But for other things, it doesn't. So you have to have that very candid conversation.
Is it a primary care focused medical school, or does it really matter? You have all the specialty services, so you're going to train all of that too.
You got it. We have it all, and they'll become, I'm sure, more primary care oriented, but they'll be every specialty.
Yeah, so this is great. Well, this has been a great conversation, Maulik. I've learned a lot. I hope the people that have been listening in have learned a lot. It's great to watch somebody move forward. One of the things we say, we're not anti-innovation at Viral Healthcare. We're not anti-speed. Speed, disciplined speed, systematic speed is great. In systematic decision making is what we're talking about. So just like a differential diagnosis, you can make the right diagnosis rapidly if you just think for a little while, what are my other options? What are the possibilities? It's the same thing. Speed is not the enemy. Innovation is not the enemy. New ideas, new trends, they usually make things better. We just have to be smart in how we choose. We have to be smart in how we execute and implement, and we have to be smart in how we fail and assume failure rather than running from failure, and design mechanisms to learn from failure. And I think that's some of the keys to moving forward. Any last comments from you for our audience?
That's a great wrap up. And I love your disciplined speed. I think that is kind of what can help the whole healthcare field in our country going forward.
Yeah, we need to improve the healthcare system, that's for sure. And it's never going to finish, but I guess that's why we're still working, right?
That's right. Thank you so much for the opportunity. This was a blast.
Well, it's my pleasure, Maulik. Thanks so much for joining us. And if you're ever in the Western Maryland region, go to Meritus Health and look up Maulik. He's just great. And he's published everywhere. He's on a variety of boards. You'll probably see him somewhere. I see him all the time in LinkedIn. So if you're following this on LinkedIn, he publishes and writes frequently for that. And obviously lots of journal articles, lots of ways to help the healthcare system. It's not just about making Meritus better. It's about making the healthcare system. And I know that's been your commitment from the beginning. So I want to thank everybody for joining us today, and we'll see you next week. If you like these type of activities, if you like this discussion, join us every Tuesday morning at 9 o'clock Pacific, 11 o'clock Central. We talk about things to make your organization more effective in both deciding and in executing, implementing new changes in healthcare. And with that, we'll see you next week.